connection, by the way.
Hey everyone, it's Safik Alawali, the digital strategist at Progress, Texas, and welcome to our happy hour. I'm joined by President Ed Espinoza, Advocacy Manager Diana Gomez, wow, and our special guest from Planned Parenthood Texas Votes, Executive Director Diana Limon Mercado. Diana, thank you for joining us.
Both of the Dianas, yes.
Both of them, yes. Diana LM, thanks for joining us. This week, we're going to be talking about the impact of SB 8 that's going to have on Texans and how Texas Dems shifted the narrative in D.C. to help pass the John Lewis Voting Rights Act. But before we dive in, today's a really special day. Today is National Dog Day 2021. And, as I was thinking about this day, I remember that Cormant Township in Minnesota actually elected a Great Pyrenees named Duke for 4 terms as mayor. 4 terms. And it got me thinking, what kind of dog would be a better governor than Greg Abbott? And you can't say any dog. So Dana G, what kind of dog would be a better governor than Greg Abbott to you?
I love Chihuahuas because I think they're so cute, but they're tough and they have a lot of bark to them. And I think a Chihuahua would do a much better job. Also, I think they're like a Mexican breed or something, Aztec warrior type of dog. So tiny, but a good heritage legacy. So that's what I'll go with.
Yeah. What about you, Diana LM?
Yeah, I was thinking about this. I'm going to say my dog because we have a Doberman. He's adorable. He's like an 8-month-old puppy, but he's like 70 pounds. And Dobermans are just, they're very loyal and they're great family dogs. And they are protective in all the right ways. So only barks when necessary, stays close to my kids and wants the best for them, unlike our current governor. And my dog is named Watson after Senator Watson. And I think Senator Watson, any dog and Senator Watson's, on the same page in terms of policy agenda, I think would be a better improvement. So
it would be a big improvement on Greg Abbott.
Yeah.
I think Ed is having some internet difficulties. He's at our new office, and we don't have Wi-Fi there yet, so he's like off of a hotspot on his phone. But I'm sure he'd agree with me that the best dog would be a Shetland sheepdog or any really herding dog, because right now we need someone to bring us all together so we can beat COVID and protect rights. And a herding dog would do that pretty well. I know my dog, Yasmin, who's a tiny Sheltie, she's pretty ferocious when she wants to get us to go in the right direction. That's what we need. So maybe we'll get a Sheltie or a Chihuahua or a Doberman to replace Abbott. I think they would win hands down.
I mean, any dog, right, that cares about Texans and people.
Yeah.
Which is every dog.
Yeah.
Right? Like all dogs care about people.
And have you seen Governor Abbott's dog in the house? He's like behind the gate and at the governor's mansion. He looks very sad.
Oh,
That's not where dogs belong. They belong out free with people. Ed, welcome back.
Good to be back.
What we were talking about is if we could replace Governor Abbott with a dog, what dog would do a better job than him?
Oh, yeah, it's because it's National Dog Day, right?
Yeah, exactly. Connection.
The first one that comes to mind is Air Bud. I think Air Bud would be a better governor than Greg Abbott. This is a dog who could ball, right? He could play ball, he could play basketball. He could just who wouldn't want a basketball playing dog as governor, especially when Greg Abbott is your current governor. So that's my choice.
Air Bud would be. He's good at everything he does. Everything he does, he's like an all-star champion, and we need an all-star champion to be a governor, not whatever we got right now.
Wait, what did the Dianas choose as a dog?
I chose a Chihuahua.
Chihuahua, yeah, good.
Because they're fierce.
Yes.
And I chose my dog, which is a Doberman puppy, which is very loyal and cares about my children, unlike our current governor. And and also my dog is named Watson after Senator Watson. So I think, dogs on the same page as policy agenda wise as Senator Watson would be a big one.
That's nice.
And Senator Watson knows my dog is named after him. So it's not a secret.
So your dog would have a good advisor in the governorship. Yeah,
Yes.
Very important. And I picked a Shetland sheepdog because I think a sheepdog would herd us in the right direction. We're going in the wrong direction right now.
I think what we can all agree with was that no matter what you picked, they would all be an improvement over what we have now.
Big improvement.
Yeah, huge improvement.
Big.
And if you vote, we can get a dog in there, or at least someone better than Greg Abbott, which is not a high bar.
Right.
So on to something a little bit more serious. September 1st, something is happening, which both Dianas, actually everyone has been working on, which is that SB 8 will be going into effect. Diana LM, can you talk us through a little bit what exactly that bill is going to do and what the impact will be on Texans?
Yeah. So SB 8 is a 6-week abortion ban that is, clearly unconstitutional. Similar bans have been shut down in all the other states where they've been introduced or passed. And 6 weeks is very early in pregnancy, right? So the standard, that the courts have set up is that states cannot ban abortion pre-viability. 6 weeks is very early in pregnancy for a person who has a regular menstrual cycle. It takes about a week to verify a pregnancy, after a missed period. Right, they may need some time to consider their options. If it was an unplanned pregnancy, to make a decision. If they decide to seek abortion, the time it takes from when you call a health center to when you actually get an appointment. And then from there, you have to begin complying with all of the states currently, nearly 24 restrictions they already have on abortion. So that is a 24-hour waiting period, a mandatory sonogram, the Misinformation of the Women's Right to Know Act, and a number of other restrictions the state already puts on abortion access. So 6 weeks basically puts abortion access out of reach for almost all Texans. I think we saw the latest research coming out of TexPep saying like nearly half of people who would be seeking abortion would basically not have access at that 6 week mark. There are some people who have means and would be able to travel to other states to get access, at a later date, but that's not most people. And also not everybody has a normal menstrual cycle. Some people don't find out until later in pregnancy. Some people need more time to consider their options, right? And complying with all the states' requirements takes time. And that's sort of the point of this, right? This is an attempt to ban abortion outright. And so what's troubling
Diana,
is not...
You mentioned TexPep. For those who aren't familiar, what is TexPep?
It is a research project out of UT, and I'm sure we can probably drop a link, but they do policy evaluation project. They do lots of research on reproductive health access here in Texas. It's a project that I think has been going on probably for 8 years or so, as the attacks on reproductive health and rights in Texas really ramped up, over the last decade. So some really good research coming out of there that can, clearly articulate the impact and the need that Texans are feeling. Obviously, Planned Parenthood, we understand what the real impact is. And the thing about the 6 week abortion ban in this bill that's different is it's not just the 6 weeks cutting people off that early in pregnancy, but it is also that this bill allows anti-abortion extremists to take doctors, health centers, clinicians, anyone that is supporting a person accessing abortion to court, basically. And so basically there are like anti-abortion, bounty hunters, vigilantes, however you sort of want to characterize it. But it is people who have an anti-abortion agenda that can use frivolous lawsuits to basically harass everybody in the process of allowing another Texan to access abortion.
And can we talk about how crazy this is? Because I'm not sure that it's entirely evident without just spelling it out that it is anyone in any state, Oklahoma, Montana, Maine, who feels as if they were wronged by somebody in Texas having an abortion could file a lawsuit. And it doesn't have to be against somebody who had the abortion. It could be any of us who gave them a ride or who put up a link on the internet. Just so broad and sweeping that it's hard to imagine that it has any kind of standing in court to really apply. But this is the law that the Texas Republicans wrote and passed, and the governor championed it. And it's just, talk about, aren't these the guys of small government?
You would think, right? And they're also, right, generally like anti-lawsuit, right? They're always like pushing for fewer lawsuits. And in this case, they're like, everybody can sue. This really does like upend how we normally think of the court system conducting business at all in the legal community. Because, right, to bring a lawsuit against somebody, you have to have what's considered standing. You have to have been harmed, impact, have a direct relation, right, to the situation that occurred. And that then compels the courts, right, to get involved in the situation. In this situation, no standing is required. Anybody, to your point, Ed, anybody anywhere can sue. If my friend, is trying to access abortion and she posts a story on social media about how she decided to have this decision, and I provided her a link to, more resources about it, and somebody saw that, right? Imagine maybe one of her high school friends who doesn't have the same opinions of abortion as her sees that high school person that they haven't seen in a decade that lives in another state could then bring a lawsuit against us in Texas, against me or anybody who supported her in trying to access abortion just because of this law, not because they have standing, not because they've been harmed, not because the abortion has taken place, not because any wrongdoing was done to them.
So I'm going to point out two things really quick. One thing, Diana, to what you're talking about is when it came to protecting workers whose employers don't want to protect against COVID, you can't sue them. When it came, I remember earlier in the pandemic, there's this whole fear that I would report on my neighbor who's breaking breaking safety precautions. Never happened. But here they're because it's a woman who wants an abortion for her own health care, then it's okay to throw all the rules to the wind. Also, I'm not going to drop a link to where you can do this, but I have seen some people on social media say, why don't we just flood that site with nonsense to crash it? And if you decided to go to that site and flood it with nonsense to cause it to crash, I would be okay with that. I'm sure everyone here would be okay with it too, because that site should be taken down because it's absolute garbage.
I appreciate the creativity of grassroots supporters.
Do you guys remember when Trump tried to hold a rally in Oklahoma and it was all the K-pop fans that flooded the ticket requests?
Thank you, BTS.
The site that Salt Vegas talking about isn't an actual Texas government website. There's just an extremist right-wing anti-group that made a website where you could submit images as well with your comments or song lyrics if you wanted to. So a lot of people have found it, have sent screenshots on Twitter, and it's been very entertaining.
And that, that is an entertaining take right at this moment where so much is at stake. And though everybody, in the ecosystem of providing care or supporting people who choose to seek abortion is at risk, right? We know that this is most directly targeted at abortion providers, at abortion funds, people who are already stigmatized and face, a great deal of risk in their jobs every single day, just simply trying to provide quality, compassionate care for people who are seeking abortion. And then, a step further than that, the bill doesn't actually allow you to sue a patient. Republicans have really taken the criminalizing of the patient or the punishing of the patient out of bills in the last, 7-8 years, because they know that even people who may agree with the extremists think that punishing women is a step too far. So in this situation, they're just simply stigmatizing everybody around the patient, right?
Yeah, just punish their friends instead.
Yeah, if it's a supportive partner, if it's a roommate or a parent who provided the funds, or whoever drove them to the clinic, all of those other people are now at risk in being stigmatized because of this law.
So actually, Diana G, we've talked about what the impact on Texans will be, and Diana L, you kind of alluded to what happens to providers. But Diana G, can you talk a little bit more about what the impact on providers and doctors would be from this?
From providers and doctors?
Yeah.
Yeah, I mean, and I'm sure Diana Ellamy could speak a lot more to this as well, being a part of Planned Parenthood, but it essentially is, criminalizing healthcare providers. And, as you've alluded to, Satvik, earlier, Texas has not even done the bare minimum of protecting Texans against a pandemic, expanding Medicare, working on maternal mortality rates. They're not really doing a lot to advocate to advance our healthcare. And now they want to criminalize doctors, people who are basically helping to provide essential healthcare, is just terrible. But I don't know if, Diana, if you heard anything from providers or what they're saying, or from clinics.
Yes, heard, of course, they are all worried about how this will impact patients and patient care. They are doing their best, clinics, clinicians, doctors, providers, to educate, all of their patients and people who are calling in about this, about what the impact is, what their options are, how they can continue to access care, that abortion is still legal in Texas. Even after September 1, if this law was to go into place, that window would be shortened, but abortion itself is still legal, and there are still resources for being able to access care, both in state and groups that can help patients navigate care out of state if needed. It is incredibly tough. I cannot pretend to know how tough it is to be an abortion provider anywhere, but especially in Texas, when so much is on the line, when the state is trying to push care further and further out of reach for patients, make it more and more difficult for doctors and health centers to provide care. There are big things, like we think about, this 6-week ban in this sort of bounty hunter provision in this law, but there is, it's really the process of death by 1,000 paper cuts. There's so much reporting they already have to comply, so many standards for their facilities and for their licensing that they have to comply, and so many other medically unnecessary restrictions that they have to comply with, that every day put their license on the line, basically, to provide the care that they know that their patients need. And, it's just, I'm just incredibly proud and thankful for the commitment of providers who continue, to be there for patients and Texans who need abortion access, and that they are willing to do whatever they have to do to comply with the law and to provide the best care possible.
So that's a great point, Diana. And, often in progressive spaces, they're like, the world's always on fire. So we're talking about like, oh, this bad thing is happening. But one thing we like to do at Progress is make sure people know how they can fight back. How can we help? So, earlier before we went live, Diana G, you were talking about an upcoming event where, Texans can show their support against this bill, and for Texans and for providers and funders. What's going on?
Yes, definitely. So a lot of the folks over at the Trust, Respect, Access Coalition, which is a coalition of a lot of the pro-choice organizations here in Texas, that includes Progress Texas, we've got together to put together a performance protest that you could do at home or outside, socially distanced, if you're vaccinated and masked, with any few close friends, in Texas, and honestly, anywhere around the United States, or if you want to do it in another country, you could do it as well. But I know Sophic will drop the link to this performance protest that will be called Bans Off Our Bodies, or Boob for short, if you want to do that and use that in a hashtag on Twitter or something. That's fun. But basically, I know that a lot of the right, a lot of the antis, really want to scare people and confuse them. But the truth is that abortion is still legal. Abortion is necessary. It's essential health care. You're not going to get rid of this need to have an abortion. And people are still going to have them. And so we are reclaiming that day on September 1st at noon to have this performance protest. There is a chant, there are movements. It's sort of recalling what a lot of other, like feminists or pro-choice movements have done around the world, especially in like Latin America, to bring attention to a lot of injustice happening there. So shout out to them. We're inspired, and we're going to be at different locations. At the link that we are providing, you can find a location nearest you. If you feel safe enough to go, you can learn the chant, learn the moves, come together and be in solidarity. Or you could do it at home and make a TikTok, post it on social media, encourage your friends to do it. If you're out of state or have friends out of state, please send it to them to let everybody know that they are not alone. There are people everywhere that know that abortion is essential health care, and bans will, we're not going to accept them on our bodies. We're going to be there for each other. And yeah, feel free to learn the material and share, spread it as far and wide as you can.
I want to add something here. Why we say the word abortion and not pro-choice or women's health. It's really important that this is a word that has made people uncomfortable, but the thing is, it is a reality. The same way that you would use the word vasectomy or anything else that has to do with a medical term, this is a medical term. And like Diana says, it is essential care. And it's important that we use that term so that we can destigmatize it. There's one other thing that I feel is really important for us to mention, is that even though the state of Texas has passed these laws, one, we don't know that these laws will stay in place. I don't think they will. And abortion is still legal in Texas. They would like you to think that it is not. The purpose of many of these laws, even though they may not hold up in court, is for people to just generally accept the idea that abortion is not legal in Texas, which is not true. It is very much still your right to go out and have this sort of thing. So it's important for us to bring those things up. If you find yourself in a situation and this is something that you choose to do, you have that right. And that's one of the things that we're fighting for here.
Yes, and aside from that action that will be taking place September 1st at noon, tell everybody you know, is I wanted to give a quick plug to a website called needabortion.org. That was put together by a lot of folks in the Trust, Respect, Access Coalition. If you yourself or you know someone who is seeking an abortion, this is a really amazing resource to find other resources to access this essential health care.
And I just wanted to remind people to all of those points of accessing Need Abortion, the needabortion.org website, saying the word abortion and working towards destigmatizing abortion, is that 1 in 4 women will have an abortion in their lifetime. And as I know, a lot of our colleagues and advocates say everybody loves somebody who has had an abortion. I have had an abortion. My family supported me through that decision. And then I made other decisions later in my life. And there are so many other incredible people that I have been able to connect with by sharing that story, and how powerful it is for other people to feel like they have the support and space that they can be comfortable in the decisions they're making about if and when to start a family and the healthcare that they need.
Earlier this week in DC, the House passed the John Lewis Voting Rights Act. And Ed, you talked about this on TV the other day. The Texas Dems had a big part to play in this happening. So for those who don't know everything about it, give us a little bit, like a quick refresher on what went down.
So transitioning to the second part of our show here and talking about voting rights, which both of the Dianas who are here with us have also worked quite a bit in as well. So I think that we've got a great group here to talk about this subject. As everyone knows, the Texas Democrats broke quorum in the legislature at the end of the regular session and again in the special session. We are now in our second special session. But when they broke quorum, it was over a bill to infringe upon voting rights in Texas. They took that issue to Washington, D.C. They elevated that issue to the national level. Why? Because it's not just a Texas issue. It's an issue that's happening all over the country. 17 states, might be as many as 18 states at this point, have passed laws since January 1st. This is in the past 8 months to make it harder to vote. This is all post-Trump, post-big lie actions to make it harder to vote. By elevating it to the national level, they drew national importance to this. And now, as a consequence of what the Texas House Democrats did, the Congress finally passed the John Lewis Voting Rights Act, which is to ensure protections for voters who have access to the ballot box around the country. Now, we're only halfway there. Right, it's passed the House. It now goes on to the Senate, and we know that there are barriers with Senator Manchin from West Virginia and Senator Sinema from Arizona. One of the things that the Senate and the House are working on right now, I believe the White House might be involved with this. I can't say for sure, but one of the things they're trying to do is come up with some sort of a procedural agreement where they can perhaps suspend the filibuster for one vote to be able to get this through and be able to provide some sort of voting rights relief to the rest of us out in the states. So we'll have to see how that plays out. But what we're looking at right now is a very big step forward at the national level, and it has everything to do with what the Texas House Democrats did this summer.
Yes, definitely. And just to let folks know a little bit more about the John Lewis Voting Rights Act, as Ed said, it passed the House on Tuesday, and it's called H.R. 4. It would essentially strengthen the Voting Rights Act of 1965, which, as many of us have seen, has been weakened by a couple of Supreme Court rulings over the last decade. And a lot of the supporters of the act up in Congress say that it would make it a lot more difficult for states to restrict future voting access. And we know here in Texas that we need that desperately. So it is really great to see this act being passed, especially if, right now as we speak, the House is debating SB 1 on the floor right now, which is a terrible voter suppression bill.
Yeah, and to just make the connection between these two things so clear, reproductive rights and abortion access and voting rights and saving our democracy, the states with the most restrictive abortion laws and that continually introduce new and deeper restrictions are the same states that are the most gerrymandered. And that's because, right, the people who are in power and want to maintain their partisan power do that by drawing themselves into maps that they only have to run primary elections, right? And then they rig the election by suppressing the vote in all of these other ways so that they can continue to do that. And then what ends up happening is it's states like Ohio and Georgia where we're constantly seeing, in Texas, where we're constantly seeing these abortion restrictions come out of, because that's the situation that they've been able to put themselves into through the redistricting process and by undermining voting rights for all people. And the people that suffer the most are the same people. It is low income, working class people. It is women. It is people of color. It is young people who need access to reproductive rights and who are the most marginalized in the voting process.
And it's all built on a lie, right? I don't know if y'all saw the video.
It's all built on a lie.
Yeah.
Who here knows Dan Crenshaw? Not in person, but has heard of this guy.
No.
Well, he's a congressperson from, I can't say where he's from really, because his district is like built like this, like infinity loop.
Everywhere.
There was I don't know if y'all saw that there was a video recently that leaked a fundraiser, right? And in that, so for background, he signed on to flipping the election in the House. That he said it was, something was screwy. In this fundraiser, he told, some Trumpy voter that no, nothing like that happened. So like he admitted it. And like the entire thing that they're doing, they're putting us through all these special sessions. Diana, I know you've been working through the special session. You're exhausted from it. It's all happening because of a lie. And it's like so obnoxious and dangerous that they keep doing this to us over and over again for like no good reason, except for to hold on to some power. Man, I hate that guy.
Absolutely. So not, none of this is founded in the reality of what Texans and Americans need and want for their families, for this community. This is all about a couple of people maintaining power that allows them to inflict harm on others. And it is sad and not what we are here for, and glad to be in partnership with Progress Texas and so many other great organizations doing work right now on voting rights happening, protecting trans kids, on reproductive rights, all the things that will make our state better here in the near future. I'm hopeful.
Yeah, and really quick, there's a few women in the comments saying that they had an abortion which saved their lives. Like, I want to appreciate that you feel comfortable, saying that out loud. You did what you needed to do, and we're here to support you and support other women Texans who might need these services, because we should all deserve that access to healthcare. It's important, and we're going to keep fighting for it.
Absolutely. It is so critical that we all share our stories. I even have a story. I have my story where, I talk about my decision to have an abortion and what the circumstances were, but an equally powerful story is my story to tell my story and how that came about and getting me comfortable in spaces where I felt that I could actually share it. And one of the most powerful places that happened was actually at a bachelorette party with some of my girlfriends in a hotel room, talking at 2 a.m, staying up late, just, talking about life and love and all those types of things. And I had one of the girlfriends that we were with sort of made a comment about along the lines of roughly like, those women who use abortion as birth control. And I had to stop her right there and say, like, what do you mean? And, tried to get her to elaborate, and then was able to share my story. And she was like, well, I don't mean you, I mean all those other women. And I said, we were in a group of, 6, 7 women. And I said, has anybody else here had an abortion? And every other woman in the room raised her hand.
Wow.
And I wasn't expecting that. I had no idea. I had talked to, one of my other friends in the room knew my story. And so at that moment, right, like we had this friend who had so many preconceived ideas about the type of people who access abortion, and come to find out, her entire group of her closest friends had gone through something similar. And we were really able to share that with her in a really personalized and powerful way, that we could, have that conversation with her, and help her have a deeper understanding of why this right is so critical for so many different people, for all different reasons that are all valid and should all be left up, to the woman, the patient, and the doctor to make the best decisions for themselves.
So I'm curious, Diana. I mean, obviously that made an impact at the time. Has it made an impact over time on that person's perception?
Yeah, I think definitely it has. We got a lot closer, and we're able, to share more even beyond that, and feel a lot of, right, it deepens your relationship with each other when you're able to share that with a person and have that understanding with them, and then your entire group to be able to share that experience and know that, right, many of them had not shared that experience before with anybody, and then they were able to share in this group setting. So not only for the person, that had the misconceptions about the types of people who access abortion, but for the other people who had themselves had an abortion, being able to feel in community and supported, and being able to, they themselves, do work to destigmatize abortion, and, release themselves of some of those feelings maybe that were being put on them by, not being able to share that story. So it's really powerful.
Yeah.
Everybody, will share their story, if and when it's the right time for them. And I just really applaud all those people who are able to share their story, who are thinking about sharing their story, who are keeping their story to themselves for their own reasons. That is equally as valid, and very important that everybody feels safe and comfortable making this decision.
Thank you for sharing that.
Yeah. That was powerful.
Well, all right. Where do we get from here, right?
Well, so I think, Diana LM, you pointed out something really important, that voting rights and abortion rights are kind of connected, right? Because the states with less voting rights have more restrictions on abortion rights. And so what it brings to mind right now, as Diana G said, is that like these voter restriction bills are going through in the Texas House right now. If we want to be able to expand abortion access, if we want to be able to do all the things that will make Texas a better place, we got to start with like, how do we fight back against voter suppression? And so Diana G, I'm wondering, what can Texans do right now to help fight back, to help support Democrats who don't want this thing to pass? What do we do? If we're hearing what do we do?
Yeah, so some, very important stuff is, it's very important to contact your legislator right now. At this moment, the Democrats have been working really hard, breaking quorum, going over to DC, pushing for the advancement of the John Lewis Voting Rights Act, which is advancing. That is success. That is really great. It put a national spotlight on what's happening here. Now that they're back, it's not over. We still need folks to show support for Democrats in the Texas Ledge. When we do have the opportunity, because unfortunately sometimes we don't, to go and to testify if folks are vaccinated, testing negative, masked, feel safe. Whenever we have the opportunity to go and testify in person, it's very important to be able to go out and be able to do that. And then also as well, Diana, Limon, you were mentioning how redistricting is a big issue. That's another way to stay involved as well whenever that happens. And the next session, these are just the never-ending sessions of the Ledge. Yeah. Folks will also have an opportunity to possibly testify and have their voices heard then as well.
Let me add one thing. The easiest thing you can do, no matter where you live, if you live in a Democratic district or a Republican district, the easiest thing you can do is call your state legislator and tell them where you stand on these bills. And if you don't know the specific bill, that's fine. It's easy to look it up. There's ways to do it. Look at what groups like Progress Texas or Planned Parenthood Texas Votes or any of our allies, look what bill numbers that they're advocating for. You can find it on Twitter, you can find it on Instagram, find it on Facebook, anywhere that you get your information from, you can find that hashtag. But call their office and tell them where you stand. Tell them what you believe in. They need to hear this. They do listen, especially if it's people from their districts. Mm-hmm. Your state legislators, your state senators, you can, and your members of Congress, but right now we're talking about the state legislature. Go to a website called Who Represents Me. Punch it in, look it up who your members are, punch in your address, and give them a call. That's the easiest thing you can do. And then, of course, all the other things that Diana Gomez just mentioned, you want to show up and do those things too.
Yeah, and you can tell them you care about voting rights, you care about abortion rights, abortion access, you care about the environment, all the topics that you care about. That's what they're there for. They're there to listen to you and to vote according to what their constituents want.
And then when you do it, tell your friends you did it and ask them to do it too.
Absolutely. That's the most powerful. Bring 3 friends along. People are more likely to get involved, volunteer, make a phone call, sign a petition if they know that they have a community around them that is involved, and they can bring a friend along with them. And we try very hard at Planned Parenthood Texas Votes to educate our supporters and our members on the connection between these, because whether you care about reproductive rights, abortion access, immigration, the environment, public schools, COVID relief, masking, all of that starts with saving our democracy and ensuring that the rights and the votes of Texans are fairly represented and that people have the access to the ballot that they need to make their voice heard. So democracy's got to be at the foundation of everything we're doing for all of the issues that we care about, if we're going to make a real change together.
I couldn't have said it better myself.
Yeah,
Yes.
well done.
Well, Dana LM, Dana G, Ed, thank you guys for lending your expertise as always. To everyone who's watching and listening, thanks for joining us. Head over to www.progresstexas.org to follow us on social media and subscribe to our email list. If you're listening to us on a podcast, make sure to subscribe and get our happy hour every single week. Y'all, thanks for joining us. We'll see you next week. Bye.